at EULAR 2025 Day 3. I'm Dr. Valentina Puccino, and I'm assistant professor and consultant immunorheumatologist at the University of Pisa in Italy. And I'm delighted to be joined here for this interview by Professor Paul Bowness from Oxford. He's a professor of rheumatology. Today I will ask him some questions about his recent session on spondyloarthritis. Very interesting question with a big audience, so I'm excited to ask you a few questions.
Thank
if
you,
you don't mind.
Valentin.
So first of all, I would like to ask you whether there is new treatment in the horizon, and do you feel optimistic about it?
Yeah, first of all, we definitely need new treatments in spondyloarthritis. I don't think we have enough treatments. And I think there are definitely new treatments coming into the medium term. So I talked about today, we have some refinements of existing treatments. For example, refinements of antibody treatments with camelid antibodies or nanobody antibodies. I also talked about some new oral treatments on the horizon. So we have new TYK inhibitors, TYK2 inhibitors, which may be more specific than some of the existing JAK inhibitors. And I also talked about oral IL-23 receptor blockers. Now, there's a pivotal trial in the New England Journal in skin psoriasis, but we wait to see about psoriatic arthritis, but I think there's potential for that. And then I also talked about some new mechanism of action antibody treatments.
And in fact, this is my second question. Within your research, have you found new targets that can be then translated in clinical practice in the future?
Yes, so I was a co-author on a paper in Nature in 2022 with Jimbo Zhang was the first author and Chris Garcia last author. And in that paper, we were able to identify from the eyes of patients with anterior uveitis and the knee joints of patients with axSpA, expanded T-cell clones. Now, these T-cells carried specific receptors, T-cell receptors, and many of them used for the T-cell receptor V-beta-9 or TCR-BV9 receptor. And other groups have gone on to develop treatments to target those cells.
Yeah, so actually a poster yesterday about autoreactive cells.
Yes.
And what about, do you think that these new treatments are changing the course of arthritis compared to old treatments?
Yeah, good question. I think it's too early to say at the moment. Probably not is the answer. But I think, we would like to have treatments, and I said this in my talk, that cheaper, faster, stronger, and longer. And the aim should be for remission or cure in SPA.
What do we need really for a better trial outcome, to improve also the trials?
Yeah. Well, obviously we have good trial methodologies at the moment, but in my opinion, I would like to see more experimental medicine in trials and using really key biomarkers or immunological markers. So examples of that would be, for example, measuring the number of Th17 cells in the blood could be very important to distinguish whether you should treat with a TNF blocker or an IL-17 blocker. And there's ongoing trials there, but that requires experimental medicine. And the other possibility would be perhaps a biomarker looking at these T-cell receptors I was telling you about. You could actually measure if patients had this TCR-BV9 T-cell, and then that would be the appropriate treatment. So I think that's the way forward in my view, is experimental medicine studies and then personalised treatment.
The best combination would be to find the right biomarker in the blood that reflects also what happened in the tissue.
Yeah, I agree.
Exciting. Thank you very much for your time. And thank you very much everybody for listening, and enjoy the rest of the conference.